Good evening, Dr. Cannon. This is Kirsty with Group 2. The other members of my group are Christy, Latasha, and Hemja. The categories that we're going to be focusing on are categories 3 and 6. So, just a little bit about Tillingate. Tillingate Living is a set of 23 facilities across 4 states that consist of skilled nursing facilities and assisted living facilities. They base their values on agility, patience, empathy, and excellence, or as they refer to it, APEX. The company's employees are comprised of 76% registered nurses, while the rest of the staff is mainly support staff. Each skilled nursing facilities have also obtained a licensed nursing home administrator as their director, and the assisted living facilities have certified assisted living administrators as their directors. Key elements that the employees are required and recommended to focus on are being community-driven, volunteering with the community, providing a good work environment, and making positive relationships with other coworkers. Their potential market really focuses on all age groups, as the company specializes in traumatic brain injuries, post-stroke patients, joint replacements, and even dementia. However, most of their population is approximately 40 to 59 years of age. Another focus includes tracking supplier performance and expected outcomes based on a scorecard. If the supplier is not performing to par and meeting their goals, then they must submit a corrective action plan. Tillingate has also worked with industry advocates to help improve their documentation systems as much of their reimbursement is accounted for through documentation. Since healthcare reform has taken effect and reimbursements have decreased, they are working with other local healthcare providers to test and refine the accountable care organization model. Ultimately, this would allow them to receive monetary incentives for efficiency and high-quality care provided to patients and residents. It was shown that their reimbursement rates have increased since improving this aspect. Lastly, they provide volunteer opportunities and serve as clinical sites for local colleges and universities. With that, they are expected to grow over the next 4 years and open up 4 new facilities, focusing on private rooms only while being located within 5 miles of a university. These ideas were taken directly from patient and resident surveys, as they wanted more privacy and more opportunities to become educated. Now to focus a little bit on category 3. We gave a score of 75% for the voice of the customer category. One of the biggest focal points for the facility is listening to the residents and supporting families' wants and needs, as well as stakeholders and market requirements. Each customer was given a survey at discharge to provide feedback. Within this survey, they focus on comparisons of organizations similar to theirs, and it also incorporates questions from CAP's nursing home survey that focuses on overall satisfaction, likelihood to recommend to others, and quality of life, care, and services. In addition to the surveys, the customers were assigned a resident advocate that was a nurse or social worker. This advocate followed the patient or resident through every step of their care at the facilities. They were able to answer questions from family members as well as filter complaints from residents and address those as necessary. They also received information via surveys that the patients wanted educational opportunities through online institutions. This is the reason Tillingate decided to locate the new facilities near a university. This also makes them more competitive than other facilities by providing these services to residents. Another major project that the facilities focused on was providing technology for communication between the residents and family members and friends. All facilities provided a media room with helpers that were able to assist and teach the residents how to use and send emails and messages. However, the residents were not completely happy and wanted to go one step further by being able to use video chat. Therefore, all of the facilities incorporated a voice-over internet protocol with webcam capabilities. The residents were much more satisfied at this point. Furthermore, the system in place for addressing complaints is above what the CMS recommends for responding to complaints. It is required that a facility respond to a complaint within 21 days by CMS, but most complaints received by the facility are responded to and resolved within 48 hours by the collaborative care teams. Once resolved, the facility director sends personal notes to each resident or stakeholder, thanking them for their feedback and informing them of how the complaint was addressed. Therefore, because they focused on multiple requirements and provide a well-deployed approach as shown above, this is why we gave them a score of 75%. We do not feel that they were fully responsive in the marketing, social media, or brand management strategies. So category 6, we gave category 6 a score of 60%, which was the operations focus category. The CEO initiated change to the long-term care model by focusing on advanced seniors' independence and quality of life. Through PDCA teams, which includes physicians, suppliers, and other collaborators, a key work process is assigned by the owner and aligns with the work systems by sponsoring the work process teams, ensuring the processes also align with the resident and stakeholder requirements, communicating APEX process measures to deliver resident care, engagement of skilled workforce, and facilities operations and management. Although it is great that they work towards a more independent life for seniors, we are not fully aware of how the physicians and suppliers were involved in the process. Improvements in the work systems helped meet their strategic objectives by bringing about new policies, procedures, and employee training in which the cost of the work systems were able to be controlled with the PDCA model. Tillingate also used the Lean Six Sigma projects taught by the Lean Six Sigma Black Belt and 2 Green Belts who were recruited, so the Lean Six Sigma teams could support in designing and improving complex processes. These Lean Six Sigma projects to date have achieved $1.2 million in cost savings and avoidance. Therefore, we can say that this has brought tremendous improvement financially. The Baldrige framework seeks working together under the system's overarching performance improvement system. Employees served on the PDCA teams to find and carry out solutions of high priority or recurring issues, which is shown to be a good initiative, but we could not ascertain for sure if these employees were held accountable for the expectations and for the improvement opportunities in their work area. Other areas of review include potential suppliers to determine whether the processes within the work systems will be performed in-house or outsourced to entities that can manage them more effectively and efficiently. They gather their reviews by using the work systems requirements from listening posts established for suppliers and partners. When focusing on improvements, Tillingate ensures that the core competencies are at the basis of the improvement. Some of these competencies include designing, innovating, and managing facilities to support various lifestyles and deliver excellent clinical outcomes, developing clinical and service competencies for a caring and exceptional staff, designing and delivering rehabilitation services to support residents' activities of daily living, and creating an educational environment to support a sense of mastery for residents. These continue to help in relating to their strategic objectives, which help populate a system-wide APEX scorecard. This scorecard ensures that it drives the practices in individual facilities, resulting in high performances. Workplace safety was discussed in depth in regards to their emergency readiness. Tillingate explained that they provide frequent testings and drills, followed by evaluation of these action plans to ensure they are focusing on the proper tools. All emergency protective plans include disaster plans, prevention plans, staff backup and recovery plans, resident safety plans, communication plans, and operations continuity plans. With each of these plans and positions, all employees are required to attend annual emergency preparedness trainings. In conclusion, we feel that through this category, Tillingate was responsive to the requirements. However, they did not go in depth on examples on how to manage cybersecurity, physician and supplier roles in these process teams, nor did they provide in-depth responses and examples on work system management. Thank you and have a great evening.